Welcome to Healthline 3. I'm Jade Balexa. We're discussing lung cancer today. It's a disease that affects millions of people around the world. We are taking an in-depth look at lung cancer, the causes, symptoms, treatments, and different forms of it. Joining me now, Dr. Samip, Master of Willis Knighton Medical Oncology, and Dr. Sergio Jaramillo of Willis Knighton Radiation Oncology. Thank you to you both for being here.
Thank you for having us.
Thank you very much for having us.
Yeah, this is an important topic to be discussing. Dr. Master, we were talking earlier in the tease segment to preview this show about how many people are affected by lung cancer. Let's discuss that.
Yeah, as I said, it's a lot of people, and every year we'll have another like 240,000 cases added. So that's a lot of people getting affected with lung cancer. And it's not like any other cancer, it leads to death in about 130,000 deaths a year. That's a big numbers. It's one of the top cancers that leads to deaths in the US. So it's a huge topic.
So let's discuss the risk factors for developing lung cancer. What are they?
Well, as probably everyone knows, it's 85 to 90% is caused by smoking, and that's something that's preventable. Sometimes we see some radon exposure or work exposure from asbestos, but the biggest thing, smoking. So smoking is a risk factor. If through this show I can even have one person quit smoking, I think we did the job. But yeah, quit smoking, that's one of the main things you can do for yourself and your family, because secondhand smoke also causes lung cancer.
And let's talk about that for a moment. Smokers and quitting smoking. How can people do that?
Well, it takes so they need support. We have smoking cessation programs. There are various drugs available these days that can help you quit smoking, and counseling. We got the smoking cessation program can help you with the counseling. So there is help available. Just ask for it, and we have seen people quit smoking and being away for years, so it's possible. So it's just you just got to decide and come to the right person and get rid of it.
And Dr. Jaramillo, what do you think is most successful in helping people quit?
In my opinion, I think one of the top things has to be you have to be determined to quit. That's probably the number one thing initially. Nothing I tell someone or he tells somebody is going to make them want to quit. They have to be, so that's probably the top thing. And then after that, there's different approaches. I do think medicines and the smoking cessation program does help facilitate that, providing them a support group and different ways to quit. Some of my patients have been successful at quitting by weaning themselves down. So let's say you're at a pack a day. You might give yourself a pack a day for a week, and then next week you go to 3/4 of a pack, and then you slowly wean yourself down. Usually the last few are the hardest ones to give up. And then I've also had patients successfully do it on just more of a sudden cold turkey approach.
How dangerous is secondhand smoke?
Well, it is one of the important risk factors. I have seen patients not smoke their life, but your husband, their wife smokes all over, and then that's why they got smoke. It's an important risk factor. It is a big risk factor.
Yeah, because
especially if you are smoking in the house and kind of stays around in the house, and any of your partner is smoking, it's a big risk factor.
Yeah, it sure is. And you were talking about, Dr. Master, it's not just the smokers who get lung cancer. Talk about the other reasons people get lung cancer.
There are certain people like exposure during the asbestos exposure in the occupational life. Radon is one radioactive substance that sometimes gets emitted from soil. Those are the risk factors, but they are lesser, and that risk factors gets escalated when smoking is added to it. So certain risk factors you can avoid, you can watch it, but smoking is something that is preventable.
So it's radon. You said asbestos.
Asbestos. It's there are some people get exposed to asbestos in their work, occupational exposure. So that's one of the things.
Would that be long-term exposure to it?
Yeah, long-term exposure is one of the key things. Yeah.
Okay. So Talk about the screening. What are the guidelines for screening lung cancer?
So, the screening of the lung cancer is an important topic because, when you have a patient who has stage 1, or I'll tell you that when it's localized, just in the lung, it's early stage, the cure rates are very high. If you talk numbers, the 5-year survival would be 60-65%. When you go, the cancer kind of spreads to the lymph node, that goes down. And when you are in a stage 4 mode, the survival is very less. So we want to screen them early so we can catch them, and they might be treated with simple surgery or a little dose of radiation and cure them. So, screening is available for all patients. Like the guidelines are specific by United Task Force, and it is patients between 55 to 80 who have been actively smoking or who have quit in last 15 years and has a 20-pack year smoking history. So there are specific guidelines for it, but so if you meet that guidelines, you get the screening. And screening is pretty easy. It's like a quick CT scan takes less than a minute. It's not like you have to like colonoscopy or anything else. It's a preparation. It's pretty quick, and it's available in most hospitals.
Okay, so you said, how long would a person be smoking to have a recommended screening?
20-pack years. So the way we calculate it is if somebody smoking 1 pack a day for 20 years, that's 20-pack years. Now, if somebody is smoking 2 packs a day for 10 years, that's still 20-pack years. So that's how we calculate it. So it's amount of smoking, age, those are the criterias. But definitely talk to your primary doctor or any other and see if you meet the criterias, and we can get that set up for you.
Would there be symptoms to go along with that? Would you be coughing? Would there be something to bring you to the doctor?
So that's the thing with if you have a golf ball sized mass in the lung or a small sized mass in the lung, you're probably not going to have too many symptoms. Like if you have a small mass in the breast or somewhere else, people would notice it, right? But in the lung, you might be unnoticed, no symptoms until the cancer is quite big enough. So when it grows bigger, that's when the people start having symptoms of maybe shortness of breath or cough, pain. But that's generally we see it's a little bigger. So the whole point of screening is that catch it early and cure it. So because until they are quite big enough, they might not have any symptoms.
And Dr. Jaramillo, what would you say to someone who has been a long-time smoker, maybe you're a loved one and you're trying to get them to go to the doctor, but they won't go?
Yeah, so I would highlight what he said about the importance of trying to catch these cancers at the stage 1 level. And, before we had the screening data for lung cancer, a lot of lung cancers were unfortunately found much later. So somebody would be coughing blood, they had some chest wall pain, they had shortness of breath, any of these symptoms, and they had an x-ray, they found a big lung mass, and they were diagnosed with either stage 3 or stage 4. And now we're having a little bit of what we call stage migration, where we're seeing a little bit less of the stage 3s, and we're catching them more of the stage 1 and the stage 2 level. So I would tell them, you need to go get checked up, because it is very important to catch this early so we can cure it with minimal side effects, and you can have a good prognosis.
Yeah.
Good advice there. So, okay, I've heard of people who have cancer, lung cancer, and they're still smoking. What do you say to that?
Well, it's a tough question, right? But anybody needs to quit smoking. Now, a lot of my patients come to me and say, "Doc, look, I already have cancer. Should I still quit?" I said, yes. The reason is, studies have shown that patients who need surgery or who need local treatments, they do better when they quit smoking. They have better outcomes with surgery, the better cure rates. And if they need chemotherapy or immune therapy or any systemic therapy, they are less bound to have complications and tolerate it better. So yes, even if you have reached that stage and if you're committed to smoking, I would encourage them. because they might tolerate treatment better and they probably have a better outcome.
Yeah, that's a good point. So we talked about the benefits of being screened, how important that is. Now we're going to take a call from Wanda. Wanda, what is your question?
I was calling the doctor to tell him about my little nephew that had, I guess, cancer of the mouth. He had to have some of his tongue removed. He had to have a skin graft to put at the roof of his mouth. He cannot talk, he cannot eat, he cannot swallow. They had to cut him around his throat. And then they had to take him back to surgery because it got infected and clean all that out. Well, he's doing pretty good right now, and they're trying to get him in rehab.
What would you like to know, Wanda?
I just wonder just what will be the outcome of that. Now, he's got to go to rehab and to learn how to talk again. What are how long do you think he could live with this?
Well, thank you for calling us, but sounds like he has a cancer of the head and neck area that he got the surgery done, and he's just recovering from the surgery. Now, if he went through the surgery, I suppose that they were looking for a curative intent. Definitely I need to look at more details, but if he went for a curative intent, then I think there is good chances of cure in head and neck cancers. He needs to follow up with the oncologist and the ENT physician and see if he need any more further treatments to prevent further cancer recurrence. But I think if they went for a big surgery, I think they're looking for a cure and go with the rehab and follow up with their oncologist.
Are you there, Wanda?
Yes, I'm here. I was trying to listen to the doctor, but he can't swallow, he can't eat, he's on a feeding tube with just liquid. And he was causing cigarette smoke and they drank beer.
Okay. Yeah, as I said, it's hard for me to give exact advice without knowing exactly what's happening, but I think if they are sending him to the rehab, we can see how he does with the rehab. They can try to feed him through the tube, get him stronger. Definitely cutting down the alcohol and smoking would help. Yeah. Does it help your question?
No, I just appreciate you talking to me. I'm trying to talk to you and listen to him too.
Yeah, definitely. Well, I would suggest that go 100% with the rehab, try to get stronger, get fed, get the physical therapy, and keep working with your surgeon, oncologist, and if there is any and follow up maybe with the radiation doctor.
Well, see, they had to cut part of his tongue off. Okay. And, and I just wonder, oh Lord, it's just very serious, He's at the Willis Knighton, north.
Okay. Well,
and he was in surgery for a long, long time.
Okay. Well.
So.
Yeah, I hope he does better, and as he's followed with Willis Knighton North, I'm pretty sure he'll be taken good care, and once he's out of the rehab, once he's feeling better, just keep working with the doctors, and I hope he does better.
Thank you for your call, Ms. Wanda. We appreciate you. All right, in situations like that, do you, through rehab, can you gain use of your tongue back?
It sounds to me, just based on what she was saying, that he had an oral cavity cancer. So usually these patients are treated with surgery with curative intent. it's hard to comment because we don't know the stage
Yeah.
and some of the pathology results, but oftentimes these patients also need radiation after.
Okay.
And so, depending on the extent of the surgery, it sounds like it was quite extensive. He was
Yes.
in the operating room for a while, and it sounds like they probably removed a significant amount of this of his tongue. And it's hard to really say whether he can come back and speak again, because sometimes they're able to remove half of the tongue, and so if he has half of his tongue, he could still maybe be able to speak. But if they removed most of his tongue, then there's no way to bring that back currently.
Yeah,
And-
that's tough.
And so yeah, his ability to communicate will be more limited, for sure.
Okay. All right, we have Linda on the line now. Linda, what is your question for the doctors?
Yes. What if you having you went to the doctor for your balance being off, and they gave you some this medicine, and it's not working, or it make your heart flutter, and then you stopped taking it. You went back to the doctor, so they did all kind of tests. They saying ain't nothing wrong, but you still been having these heartbeats that's irregular.
She might be asking about like atrial
What do you
fibrillation,
do?
maybe, irregular heartbeat.
I don't know if this is related to the lung cancer, but if you sounds like you have been having issues with balance, and your doctor is trying to find out the reason behind your issues with the balance. I really need to see what all the doctor has done on the management and what is the reason for you to have that imbalance before I can comment on it. I would definitely suggest you follow up with your primary care physician.
Yeah, thank you. Thank you so much, Linda. All right, we're taking your calls about lung cancer, so bring in your questions. Zach, thank you so much for calling. What is your question?
Hey, how y'all doing?
Great.
Just a quick question. So, my mother had lung cancer. She unfortunately passed away from it. What are the odds that is that genetic? I know she's a smoker, but is there any chance that that's genetic or gets passed down generations? If my son?
Well, that's a great question. We haven't seen a great genetic link that in lung cancer, like any other breast cancer or ovarian cancer, we do have a genetic link there. In lung cancer, there is not like a genetic test that we can do and find out whether it's genetically inherited. It's mostly smoking related, so I don't think so.
Okay. All right. Well, I definitely appreciate it. I think that's all I got.
You're
Thank
welcome.
y'all for what you do.
You're welcome. Thank you. Thank you for
All right, have a good
calling.
one.
Thank you. Yeah, that is a good question about genetics. So it's mostly smoking and environmental factors that can cause it. Lisa, thank you so much for calling. What is your question?
Yes. What exactly do they test for to see if you have lung cancer?
Well, if you talk about the screening, like if you meet the guidelines for this, you have a smoking history and you meet the guidelines, then it's a CT scan. That's a low dose CT scan. It takes about 15-20 seconds or less than half a minute. You just lay on a CT scan table and they do a quick scan, and then the radiologist or the lung doctors read it to see if there is any nodule or anything. That's for the screening testing. And now if there is any patient who has more advanced disease, then we do further testing like a PET scan or an MRI and biopsy of the suspicious lesions to know the exact diagnosis. The biopsy can be done by the lung doctors through the bronchoscope or by radiology doctors for the biopsy, for the CT guided biopsy.
Well, I'm asking because a couple of years back, I went to the ER and they said I was winded, so the ER doctor did a CAT scan on my lungs and came back and said that they had no fluid, but the results here says that I have a minimal biliary artistic changes, and I didn't know if that's part of having cancer in the lungs or because I get very winded when I get a length of talking or just anything. I get winded and have to catch my breath and sit down. So
Well, if it was 2 years ago, you might want to reach out to your primary doctor to see if you do qualify for a repeat scan. But if it was atelectatic changes in the lower lung, that could be from a lot of things like recent infection, inflammation. In lung cancer, we generally see some lymph nodes enlargement or some nodules. But I would certainly, if it's been 2 years and if you're having symptoms, I would certainly reach out to the primary doctor and see if you qualify for a repeat scan.
Well, actually, I have a lung doctor. I'm going to a specialty tomorrow for my lungs.
That's great.
And I know years ago I did a 6-minute walk test and I didn't pass it. And my father years ago had COPD because they said he smoked for 30 years. And so I don't know if I have lung cancer or COPD or what. I just know I didn't pass the lung test, the 6-minute walk test years ago.
Yeah. But I'm glad you were able to see the lung doctor soon, and definitely they can address whether it's a COPD or a spot based on the exam and the scans. So I would certainly follow with the lung specialist and see what they have to say.
And then if I have lung cancer, I need to go to someone like yourselves, right? Is that 2 different types of doctors?
So yeah, the lung cancer is taken care of by a group of doctors. Like I am the medical oncologist, work with the immune therapy and chemotherapy. Then Sergio is our radiation oncologist. Then we also have lung physicians like pulmonary that you're already seeing. But if there is anything you need, you can always call us, and we'll be happy to help.
Okay. Well, I thank you so much for your help and your time.
Thanks for calling.
Thank you.
All right, some good questions. Thank you, callers. We appreciate you so much. So let's talk about if you get diagnosed with lung cancer and you have to get treated. Dr. Master, what are some side effects of chemotherapy?
Well, the chemotherapy has came a long way in the last couple of decades. Obviously, chemotherapy is not easy. It has its own side effects, but when we are combining with chemo with immune therapy, we are seeing good responses. Just going back to the historical perspective, years ago when we were just using chemotherapy, we were seeing like the just chemotherapy would add maybe a few weeks or months to the patient's life. I'm talking about stage 4 cancer. But when we add immune therapy, the survival doubled. That was revolutionary. Now, talking about the chemotherapy, the side effects are there, like nausea, vomiting, some hair loss, but they are manageable. We have such good support things available for nausea, vomiting that I have not had too many patients complaining that, oh, I'm nauseated all the time, it's terrible. Obviously, you have some side effects, but they are manageable with the support that we have. You can develop some low blood counts and allergic reactions, but we have gotten better over the years in managing those side effects and try to get those patients through this chemotherapy safely. Low blood counts can happen. Sometimes they develop a kidney injury that we need to be monitored. So those are some of the side effects that we see. Diarrhea is seen sometimes, and we have antidiarrheal medicines for that. So yes, chemotherapy, it's hard. I'm not saying that it's not hard, but with good support and we can try to get you through that.
Hello, Jane. What is your question?
My question is that I was diagnosed in 2013 with stage 3B non-small cell, and I never missed an appointment. I went through all the chemo and radiation and came out okay. But then in 2018, I was diagnosed with a ground glass opacity type lung cancer, and I did get the proton therapy, and so far I think I'm okay.
Great.
But my advice to these people is, if you get it, do not miss an appointment. Go all the way with these doctors. They can do it, and I'm living proof. I'm working. I'm doing fine. I never missed anything. So that's all. Bye.
Well, that's great.
That's great.
Thank you for sharing that story. That's very nice of you to come and share that story. But yeah, we have seen this happen more and more. So it's very encouraging when you come and talk about this. So thank you for that.
And Dr. Jaramillo, talk about radiation in the treatment, because like Jane, she had radiation and chemotherapy, she was saying. So let's discuss that for a minute.
Yeah. So just like the side effects of chemotherapy have gotten a lot better with newer drugs and better medicines to deal with the side effects, likewise, over the last few decades, radiation has had a pretty dramatic improvement in technology, and that has vastly translated to decreased side effects. And so with radiation is a local treatment. And so a lot of the side effects tend to depend on where the tumor is located and what other structures are nearby. And so let's say you have a very peripheral tumor located near your ribs, located away from any of the central structures like the esophagus. For that, I would expect maybe some fatigue during radiation. With modern techniques, highly unlikely for you to have any inflammation of the lung or have any significant shortness of breath or end up hospitalized with pneumonia or something similar to that because of modern techniques. If you have a very thin body habitus, sometimes and the tumor is very nearby that area, you could have a little bit of darkening of the skin and a little bit of skin irritation. If you have a tumor located near the esophagus, then you could have a little bit of esophagitis. So that feels like some difficulty swallowing, some discomfort, heartburn-like sensation, and that might translate to some weight loss during treatment. But vastly, the patients are able to get through the treatment just fine without any significant hospitalization, and many of them, like the caller, could go on to get an additional radiation course if they develop a recurrence.
Mm-hmm. And it sounded like she had 2 different forms of lung cancer. One was the small cell lung cancer.
Yeah.
So there's some different treatment options for different stages, right?
Right.
So can we run through that
Sure.
real quick?
Yeah. So for stage 1 lung cancer, first we have to figure out what your overall health is. And as Dr. Master alluded earlier, a lot of the patients are smokers. And so there's a lot of comorbidities that go along smokers. Sometimes they have high blood pressure, they have diabetes, some of them have heart disease, previous stroke, they might have a COPD, they might have emphysema or other health problems. And so this tends to limit how many of them can get surgery. So the first step is to figure out, can you have surgery or not? Are you healthy enough to have surgery? If you are healthy to have surgery, then you have either surgery or radiation as an option. If you're not healthy enough to have surgery, then that only leaves essentially radiation as the only option. And in the case of stage 1, we can treat it non-invasively, 3 to 5 treatments with very minimal side effects and excellent control.
Okay. All right. So it sounds like there's definitely some help for people out there, and like the caller had mentioned, keep going back to her, but so glad that she recovered. So there's definitely hope for people with lung cancer out there. You need to catch it early and also go to your appointments like she had mentioned. So before we go, let's get some final thoughts from you both. Dr. Master, we just have a couple minutes to go. So,
well, as I said, the lung cancer has come along a long way. We didn't touch much on the immune therapy, but with the advent of immune therapy that is added to chemo or given after surgery or radiation, the survival has doubled or even more, okay, with a good tolerance. There are various targeted treatments for specific type of lung cancers that specifically targets what mutation you have, and we do check for it and then use the drug to target that specific mutations. We use that a lot in stage 4 cancer. Sometimes we use in earlier cancer as well. So the treatments for the lung cancer have improved. They are more tolerable and they're working better. So that's a big beast, but I think we have some weapons to fight it now.
okay.
Some good weapons to fight it now.
Yeah, absolutely. And real quick, before I let you go, Doctor.
Yeah, so if you're diagnosed with lung cancer, reach out to us and we can get you plugged in with the right team, which might likely involve a medical oncologist, a radiation oncologist, and you'll hopefully have a much better prognosis now with better treatments.
All right. Thanks for joining us. Have a good day.